So state of AIDS in Mississippi. I am Marreo McDonald. I am representing BTAN, Mississippi. Mississippi is one of the most rural states in the United States, and it's also the population is the poorest, where the population has a big proportion of black people, other than the District of Columbia. And it's #1 in the nation for poverty. Our median income is $32,919. Our population rate is 2,844,658, where black people represent 36.3%, and our white counterparts represent 61.4%. Our high school graduation rate and higher is 72.9%, where our bachelor's and higher is 16.19%. So 16.9% of that 72.9. Our community epidemiology profile. The rate of HIV among African Americans is 7 times higher than our whites. The race is highest between the African American population and the Hispanic population. And African Americans also account for 76% of the new infections in 2013. Our transmission routes are MSM sexual contact, 38.9%. We also deal with a good number of heterosexual contact and not reported risks. So that's higher than the heterosexual, so somebody's not telling like how they are acquiring HIV. So my target population is the African American community, the black community, because wherever you look at sex and race, anything, the African American population is higher. So the general African American community is the target population and not just MSMs. So our HIV prevention need, when I did my community assessment, I noticed a lot of things that, we need and that we don't have. So for prevention, I want us to build a conversation for our parents to where they'll be comfortable with talking about sex, because you don't want nobody else outside of your home teaching your children something that's sacred like sex. I mean, sex is a natural thing, and we're gonna have sex even when you're told not to have sex. So we shouldn't tell our kids not to have sex. We should teach them the right way. And then, also give them an age range of when they should have sex, not 12-year-olds and 13-year-olds have sex. But even though they are having sex, because we are testing young people of youngest 13, and they are coming back positive. We need more culturally sensitive messages, so not only just making the HIV subject around the MSM community, but making it around like the black community, because it's the epidemic in the black community as a whole. And if we force it on the MSM community, then the heterosexual community will be like, oh, that's not about me. I don't need to hear nothing about HIV. That's for gay men. We need partnerships with faith-based institutions, because in the South, we're in the Bible Belt, and everybody runs to religion for everything. So we need to actually get pastors and stuff involved into actually having like health seminars. They have health seminars, but it'd be around cancer and obesity and stuff like that. But we need to get them to talking to our youth about sexual activities and engaging in sex. And also our focus on our youth and their sexual partners. In treatment, we need to increase access to the affordable health and life insurance. I noticed that a lot of insurance don't even take people that are HIV positive because they are at a higher risk of dying and stuff. Assurance of confidentiality. So Mississippi is small, and everybody knows everybody. So we need to build a level of confidentiality in the healthcare field to where the people will be more comfortable with whoever is their healthcare provider, whoever that may be. They are comfortable with opening it up and letting them know exactly what's going on with them. Increase access to transportation to medical care. A lot of our physicians are based in like the cities of Mississippi, like Jackson, Gulfport, North Mississippi, and the people in like the Delta, Mississippi Delta, they don't have nobody to really go to for services, so they have to go out of their community and go into another community. And then Mississippi being a state of poverty, and then a lot of people don't have access to like transportation. We don't have a transportation system for the entire state. Jackson has a transportation system, but their transportation system is only for the city of Jackson and not like everybody in the Jackson community, but just the city base of Jackson. And holistic comprehensive medical care. We want to make sure that we are dealing with not only HIV, but everything that that person is dealing with, because we don't want to put this person on meds and then you have to take food with your meds and then you don't have food to eat. So we want to be able to provide you like to a food pantry or something like that. Psychosocial needs, implementing stigma reduction strategies, and that's what I was talking about earlier about making HIV a holistic subject and not just the MSM subject, and we can reduce stigma that way. Increasing HIV advocates, having more people to speak out, male and female, heterosexual and alternative lifestyles. We need everybody speaking out so they can put a face with HIV and not only just saying that it's just the MSM community that's dealing with it. Create more jobs. If we create more, thank you. If we create more jobs, then we'll have like more people into like health insurance and stuff like that. And provide services on a fee sliding scale, which Open Arms Healthcare Center does, which is one of the first and only LGBT emphasized health facilities in Mississippi. It's under the umbrella of My Brother's Keeper, and we put them on a fee sliding scale. So if they come and see the doctor and they don't have insurance, we'll charge them like $20 to see the doctor, or like $10 or whatever they can, give. And sometimes people come in free because we have people donating to the clinic to where we can provide services to other people that don't have any money at all. So for my gap analysis, I used the human ecological model for human health and wellness. And in that model, they use internal environment, near environment, distant environment. And so in the internal environment, they deal with like physical health, mental health, emotional health, and spiritual health. And in the near environment, they deal with like the things outside of yourself that you deal with every day, like your friends, your family, your doctor, your house, clothing, food. And then in your distant environment, that's everything outside of what you deal with every day that has an effect on your near environment, like transportation systems, medical systems, education systems, and stuff like that. So the gap analysis that we need to focus on for the internal is the fear of stigma, the knowledge of HIV, self-efficacy for adherence and or prevention, distrust of healthcare, personal belief on treatment. In the near is the social support and trust, including families, communication levels, confidentiality and privacy in the healthcare system, convenience and responsive services. And in the distance is poverty, education curriculum, cost of service and care, and access to services. Black Treatment Advocacy, Black Treatment Advocates Network. This is just an overview of what BTAN is. I'm pretty sure everybody up in here knows what BTAN is. We done heard it twice today. So it's like the same exact thing. So BTAN is an initiative for the Black community. It started with BTAN, Black AIDS Institute in Marreo, and then Black AIDS Institute decided to relaunch it in 2010, and they took the initiative on their own to actually keep it going. So these are the 4 project areas: treatment, education, patient navigation, disclosure, and advocacy. This is the logic model which all BTAN nationwide goes by. We do our own thing, but this is our foundation right here. Advancing BTAN Mississippi. So BTAN Mississippi started out as BTAN Jackson, and then Black AIDS Institute. They saw the good work that BTAN Jackson was doing, and they were just like, y'all might as well just cover everything. So we just became BTAN Mississippi, and we doing our thing, So some of the things that BTAN Mississippi is doing, we have already implemented one of the projects that was proposed last year by Cedric Sturdivant, and his project is Men of Power, and it just focused on the MSM community and getting them to become opinion leaders and actual peer navigators for our community as the MSM community. So during my internship, that's when we expanded BTAN Mississippi. So we reached out to Gulfport and Clarksville. And when we did our 3-day training, our 1-day training in those cities, we had increased our membership by 15. BTAN co-chairs, this is Cedric Sturdivant. He is our host agency co-chair, and Linda Stringfellow, she is our community co-chair. Components of the BTAN committee chairpersons, we have the treatment education, Lisa Williams. She works with G.A. Carmichael in Canton, Mississippi, and she is over our treatment education, and she does treatment education at G.A. Carmichael. The patient navigator is myself as the co-chair. I once was a peer navigator, but then I got promoted into a grants management specialist. So I still do this, since I'm out of the prevention field, I still do BTAN work as my go-to for my relationship with the community still. Disclosure is Marcus Mcpherson. We're gonna have to find another disclosure person because Marcus moved to New York on this, and he's working on his master's. So congrats to him, but hey, just left us hanging. Kiara BTAN, he's also leaving us soon. He's coming to LA. So that's one of y'all new recruits if y'all want to get him. We have members that's in the subgroups. Some people just there, and some people actually do stuff. So just counting, these are the people. And I guess my component, the patient navigator, was the easiest thing to get into. So everybody wants to be well, I get in there. All I gotta do is tell people where to go. I get in there. So that's why my number is larger. All right, developing partnerships. So for HIV services, we have My Brother's Keeper and Open Arms Healthcare Center, Building Bridges, which is another community-based organization, AIDS Service Coalition, South Mississippi AIDS Task Force, which is in Gulfport, Mississippi. For mental health services, we have Hines Health Behavior Services. We have Gulf Coast Mental Health and Mississippi Department of Mental Health. And for housing, we have Housing and Law. We have Grace House and Mississippi Center for Justice. And for our traditional Black institutions, we have Jackson State that we collaborate with, and Tougaloo, and Mississippi NAACP. BTAN training. So at first, I was just I ain't do no 1-day training. I don't even remember it. But then I remembered, I was just when everybody was just oh, it was just an 8-hour thing. I was just oh, I did do that. So I had to rush and, put that up in my presentation so they won't count off on me. So I did a 1-day training And like Gerald said earlier, you know, you want to clean up home first before you go out. So I did my one-day training with Marreo's Keeper staff, and I did my presentation on the origin of HIV, HIV life cycle, the side effects of ART, and understanding client type. And the attendees was our prevention staff, new hires, and our interns, which this is a picture of our interns, because I did them sick. So for the 3-day training, the topics were the HIV science and treatment, living in Mississippi with HIV. I did the HIV science and treatment training for for the 3-day training. We went to Jackson, Mississippi. Well, we were in Jackson, Mississippi, Gulfport, Mississippi, and Clarksdale. Cedric Sturdivant did living in Mississippi with HIV. He also did biomedical interventions. Linda Stringfellow, which is another coach here, she did community mobilization. And Kiara Badun, which is our chairperson for advocacy, he did our advocacy component. So we focused on our problem statement, which we will see later, because we did education and we had people to understand how to advocate for themselves. And that's mainly what Cleaning Up Our Mess, which is the project that I'm proposing today, is mainly about, is just advocating for yourself and understanding the education. So we collaborated with Merck. Merck provided our lunches, and Kaita Mustafa, she also did a presentation on understanding the medicine. She showed us how to go through and actually look at the paper and understand like what's going to be the side effects with medications I don't need to take with it, and et cetera, et cetera. We also collaborated with My Brother's Keeper, the Mississippi Department of Health, and Aaron E. Hearing. Aaron E. Hearing is in Clarksdale, Mississippi. My Brother's Keeper and the Mississippi Department of Health, they allowed us to use free space. So for the training, our overall knowledge increase was at 53%, and the attendees, they were saying that, you know, that they was interested in, you know, learning more about BTAN, and they would attend more BTAN trainings, and they were very pleased with the knowledge increase and loved all topics covered, and we had like 30 people at each. And this is just actually an image of one of the trainers. This is our flyer and one of our evaluation forms, and I did not just put that one on there just because they said they really enjoyed the training. Those were mainly, most of them said. And some people just didn't put nothing. But we did get very satisfied on all of our evaluations. So, but my BTAN proposed project is cleaning up our mess, our messages, educators, silence, and supporters. So my problem statement is, according to the Mississippi Department of Health, African Americans account for 76% of 556 newly diagnosed HIV positive individuals in Mississippi, which could be due to the lack of education and having limited access to quality health care. So my goal is to increase HIV science and treatment literacy in the African American community and healthcare providers, and also educate the community about the Affordable Care Act to lower the risk of transmission in the African American community. And two of my objectives are, by December the 31st, 2015, BTAN Mississippi will have educated 200 African Americans on HIV science and treatment literacy and Affordable Care Act during 10 3-day group sessions of 20s per session. And also for the healthcare providers, we would educate 20 of those people in a 2-day, 5 per group session. And that changed because, you know, healthcare providers have to be on call and stuff like this, so we don't want all of them to be in one room and then somebody dying and, you know, and nobody out to help. Because I don't want them to leave me, because I got something to say too. Alright. So with my messages and cleaning up our mess, we will focus on like delivering the same messages in different ways. Like Gerald and Shalori was saying earlier that they was reaching out to faith-based organizations, so they had to change the delivery of their message. We will also be reaching out to faith-based organizations, as well as schools and Boys and Girls Club, because I really want to focus on our youth, because if we get our youth, we can grow out of HIV, and we can kind of like the older crowd, if they want to listen, they can, but if they kind of like stuck in their ways and they don't want to be associated with anything dealing with HIV, so when you present anything on HIV, they were like, oh no, I ain't coming to that, I ain't got it. Okay, we know, we just trying to educate you, well, we don't know. But we just trying to educate you on how to, take the necessary precautions to protect yourself if you're not already positive. And if you are positive, we're trying to teach you how to get into care and understand the diagnosis. Get the attention by responding to the audience desire to know. So we don't want to go up in there and I'm sorry, y'all. I am so country. I am so country. we don't want to go into elementary and we educating them on the same level that we will be educating healthcare providers on. And that's what I was trying to say. It just took a minute. Sorry about that. And we want to deliver the message to the target audience. Alright, so our educators, we will focus on updating their knowledge, making sure they're not presenting outdated knowledge like, some people do. They get stuck in their own gear, and so we want to also make sure that they have a rapport with the community, because we don't want nobody to actually be offended by the person that's presenting. Like if they had like a bad encounter with the person that's presenting, we want to make sure that everybody is culturally competent and culturally sensitive, so nobody would be offended in the room. Silence, we want to address stigma, we want to focus on status disclosure. Brandon had spoke earlier about his the 5 W's, who, when, what, where, how, all that. We want to also educate them on how to talk to their healthcare provider, because good scenario. Well, not a scenario, good true story. The doctor that is diagnosing everybody with cancer in order to do the insurance fraud. Have y'all heard about that? Okay, so it's this doctor. He is diagnosing a lot of his patients with like cancer and everything, and telling them their health is bad. He doing surgery on them, and all he wants is the insurance money. So we want to educate our people on how to actually sit down and talk to their doctor, tell their doctor exactly what's going on, because black people, if we go to the doctor, some of us, if we go to the doctor and we go up in there and our hand cut off, and they be like, well, all you need is brain surgery because your hand not really cut off. But I see my hand cut. Okay, well now my head hurt because you said I got brain problem. And I'm one of those people because I have anxiety real bad. And if the doctor tell me that something is wrong, I am finna panic. So also by educating them, I am educating myself, and we'll be educating each other. And we'll also focus on our supporters. So our family members are part of our supporters, because our family members don't understand the alternative lifestyles. So we would actually get them into counseling and actually get to see like what is the core problem, like why you can't understand why this person's life is like this, and get them to open up so the problem can be alleviated. We also want to focus on our policies and laws. When I went to New York a couple of weeks back, I went with Columbia University in Amphar, and I know nothing about policies and laws in Mississippi. And that's what they brought us up there for. I didn't know that. They just told me that I was accepted into this program. I didn't know how I was accepted. I was just like, I came here. I didn't know what I was getting myself into. I was just glad to get out the office, and I was glad to be out of Mississippi. so I went. And so they was up there talking about policies and laws and all this stuff, and I was just like, wait now, I know nothing about what y'all brought me up here for. So I knew the right person to call. Some of y'all probably know her, Valencia Robinson. I called her. Valencia is a person that's going to be steadfast in what she believes, and she's going to make you talk about it right then and there. So I called Valencia, and Valencia is actually helping me put together policy advocacy presentation for our community as well. So I will be including it into my education and my messages as well. And we also need to focus on our funders, because everybody wants to send money to Mississippi, and they want to send us like $500. And they want to send everybody else like millions of dollars to do stuff. So we like the pilot of whatever they're trying to do. And then everybody else is like, you know, well, here go $1 million. I don't care what you do with it, but Mississippi, we want to make sure y'all do exactly what y'all supposed to do with it, because we using y'all to make sure that the program actually works. But we gonna give y'all this money. But, you know, we still go. We still do it. We need the money. We don't care. We need the money, so we gonna take your money and go with it. Okay. So my project proposal plan will relate to the findings of my needs assessment by advocating for services in the areas where there are no physicians available, educate the community, address stigma by making it a general public health issue and not just an SM issue, etc. BTAN Mississippi love the idea of cleaning up our mess because it focuses on the Black community as a whole and not singling out a certain population. My process of evaluation, I haven't evaluated cleaning up our mess yet, because we haven't implemented cleaning up our mess. The internship actually helped me pilot cleaning up our mess, and we monitored that process by doing evaluations and pre and post tests. And that's what this statement is saying right here. BTAN Mississippi is also working towards advocating for policy change in Mississippi, and that's what I was talking about earlier. We will use Marreo's Keeper evaluation team, since we are in-house in Marreo's Keeper, and we can just ship all our information to them and they can just do it for us. Challenges, seeking funding, successes, utilizing MBK's evaluation team, and what changes, we had more members and reaching members outside of the Jackson area. Successes in AHU and fellowship. My successes was retaining the information. Also my networking, because I love that I've gotten to meet everybody here and actually been able to actually build a relationship with you guys. And hopefully we can keep that going outside of graduation. And also learning from you guys as well, seeing what y'all do in y'all communities, and then adapting it to see if it's suitable for MBK. Some of my challenges were the blogs. I don't like to hear myself talk, and so when I watched the videos, I was just like, you don't sound right. I'll delete it, and then Denisha should be like, Maya, hey, you did your blogs? I said, yep, you gonna get them. I'm gonna send them now. And every time we get off that phone, I'll try to do one, and then I'll like, nope, delete. So she gonna get them one day. Okay, and trying to manage time for AHU and my job duties. Well, she not gonna get them, but you know. But yeah, I gonna get them. But another challenge is trying to juggle between the AHU work and my job duties, because even though they said they let me off, they did not let me off. They probably still calling me now. So, in conclusions, my conclusions, so next steps for BTAN Mississippi